Mr. Young,
Here.
Mr. Furman,
Present.
Ms. Namie Dyer. Here. Mr. Torres. He did notify that he'd be a few minutes late. Dr. Hans, she did notify me that she wouldn't be able to attend the meeting. Ms. Newman,
Present.
Ms. Root.
She notified me that she would be late too,
Okay.
but be here in a few.
Ms. May, she notified me that she wouldn't be able to attend tonight. Ms. Woodruff,
Present.
Mr. Landsman,
Here.
Mr. Cowan.
Present. Okay, the next order of business is public comment. Do we have anyone who's online? No? Thank you. We do have a request from Fred Cummings. Welcome. Thank you for coming, and you'll have 5 minutes or less, whatever you prefer.
All right. You hear me okay?
Yes.
All right, I'm Fred Cummins. I'm president of the Alliance for Mentally Ill of Oakland County. As you may recall, I think it was just before Christmas, I talked about reforming the system, the need to do so, and the fact that there's a lot of money in the state that needs to be spent, and it ought to be spent on transforming the system. And there's an opportunity to do a lot better for the people we are supposed to be serving. I want to talk a little bit more about that. Just a little background. I retired from HP as a fellow in information systems. Before that, a fellow with EDS, and before that, I was with GM. I've been around information systems for a long time. One of the things I indicated in my list of things that need to change is we need a consolidation of information systems. Every organization, every CMHH, every PHP has got an information system, and the state has information systems. And they're all about the same thing, and they're all kinds of duplication and all kinds of doing it differently. And that's stupid. That's bad business. All those systems ought to be consolidated at the state level. That doesn't mean that you can't have your own piece of the system for each CMH or each PIP or where the organization is in terms of the people you're serving. But the way you serve them, the way you run systems should be consistent. And the CMHs, PIHPs ought to be participating in a leadership team that decides what's in those systems and how they work and how they're supposed to be run and how they improve. And given that you've consolidated, there's a lot of money to be saved, but there's a lot of opportunity for improvement, which can be improvement to every CMH across the state when it's an improvement. And we can do better in terms of reaching the contact with the people who are serving people directly or indirectly and keeping records properly and keeping in touch with what's going on. So there's a lot of things that can be done to improve these systems, but right now is every CMH trying to do their own thing, and of course little CMHs aren't doing very much, but they could be sharing in the same benefits for every CMH. That's the first part. The second part is consolidate direct care service providers into one network, one contract network. One contract for each provider in the state. Right now we've got providers who are serving multiple CMHs, providers that are serving multiple direct core agencies. Each one of those is contracted with a different organization, with different terms. And we've got this Oakland County is contracting with providers that are, some of which are being taken care of by Wayne and Macomb counties, and maybe Washington and others. So there are multiple contracts. And you got group homes that are serving people from different counties, and therefore they're serving people under different contracts. So it's a mess. It's stupid. It's just bad business. So that goes along with consolidation of systems. You consolidate the systems so that you're contracting with all these people. You're also paying all these people. And all these providers are now serving the state, not just individual counties. So you don't have to negotiate with some other CMH if you've got somebody who needs to move to a different location, different part of the state. And people can go across the state and be served consistently across the state if they're going on vacation to another part of the state. It just eliminates a lot of barriers. It also makes the state responsible for the fact that these people are underpaid. They can't do the job, and we can't keep them staffed. And we don't have vacancies when we need them. All kinds of problems that should be handled at a state level. Now, the reason we got here.
Mr. Cummings, if you could you got about 30 seconds. So
All
if
right,
you could wrap
I'll wrap
up,
it
I
up.
appreciate
The
it.
reason we
Thank you.
got here is because leaders of the state government don't want to have too many state employees. Well, I'm sorry, but they've got thousands and thousands of people who are employed by state money, but they aren't state employees because they're all these contractors. And that's stupid. So keep in mind, this is a game played at the state level in politics saying, well, we've cut the size of government. Hell, they have cut the size of government. They've blown it out of proportion. So let you think about that one. Consolidation, information systems.
Yeah, we will.
Provider network.
Some of our information systems people are right here, so thank you very much
And
for that suggestion.
money to be saved, to be spent better on serving the community.
I'm all for cutting out waste. Thank you. Next item is the approval of our agenda.
So moved. Seconded.
Motion, supported. Any discussion? There being none, all those in favor say aye.
Aye.
Aye. All those opposed? The motion carries. And we will now hand it over to Malkia Newman, who chairs our Policy Management Committee, for that part of the agenda. Thank you.
Sheila, how many people do we have on policy here? Oh, we got one. Okay, thank you. First up for us is the legislative update with Mr. Ben Bodman. Bodkin, I am so sorry.
I answer to a lot worse.
We don't want to call you worse.
Well, good afternoon. Thank you for allowing me to be here today. It's a great pleasure and honor to serve you all as you serve the folks in Oakland County. I want to give you an update. One housekeeping piece of information. You have a couple of handouts in front of you. They're very boring looking. They both look like this. One's for the House and one's for the Senate. I'll refer to those a little bit, but I want to make sure that I give credit to MERS News Service for the content inside. They were very kind to let me allow me to use the photos and their bio write-ups for the presentation, so I just want to make sure that I did that. Got a few things to update you on. First and foremost, I want to congratulate you on a stunning victory on 597 and 598, the attempt to privatize the mental health system in Michigan. You did a great job. I remember sitting here 4 years ago actually, and the question was, well, it's the leader of the Senate. We can't fight that person. And my answer was, sure we can. we can try. And sometimes you get what you need, you know. And we did that. And you did a wonderful job. I want to credit Dana and all of the work that she did to help educate legislators and others across the state on that issue. You were a huge part of why that is not going into effect now. And I want to make sure that you understand that you know that, and you can be proud of that. You did a great job, really great job. And I think we're safe for a couple of years, on that issue, at least. So that's good, that's done, we don't have to worry about that right now. Provides some opportunities for us, though, going forward, I think, and we can talk about those too. On the bills that would have centralized, so I call these the privatization effort and the centralization effort, right? One package of bills would have kind of privatized the system. The other set of bills would have centralized the system. That's the Whiteford package, kind of at the state level. That, of course, it sounds like a good idea because you can consolidate and that kind of thing. But what you lose is the opportunity to create a system that works in your county for the people that you serve, and that really just never got off the ground in Lansing, and so that was one that also failed during the last term. So both of those things that would have disrupted, harmed, hurt, reestablished a different system in Michigan, both failed. And so now I think there's an opportunity to talk about good change, right? We can make good trouble now, to quote from others that came before me. There's an opportunity to look at good, positive reform to the system. Some of the things that you're doing here in Oakland that aren't being done other places. Some opportunities to work with other stakeholders in order to improve things like what happens when we have CMH borders. A person lives in one place, wants services in another, et cetera, right? What happens when a person moves from one place to another? Who's responsible for that care and service? Those kinds of things. Hospital beds and getting folks out of the ER quickly, et cetera. And getting placement services, et cetera. All those things, right? Those are things that we have an opportunity to really work on now that there's not a threat to the entire system in front of us. So we've kind of sidestepped the train, and we have an opportunity now to really look at positive things going forward. To that end, there will be a behavioral health subcommittee of, I believe, Health Policy Committee in the House. It's one of the two things. There are two things that the House kind of wants to concentrate on. One is behavioral health, and the other is housing. So there will be a housing subcommittee, and also I think that'll be a subcommittee of families, if I'm not mistaken. The other subcommittee will be behavioral health, I believe, through health policy, but also could be families if you think about that. And those subcommittees, I don't want you to feel threatened or afraid or fearful or anything like that. This isn't the same kind of concentration as we've been having the last 6 years, okay? This is designed for how do we improve, like legitimately improve care that's being given across the state for behavioral health. So these are positive opportunities, not attempts to, tear down or destroy. So I think that will be great. It should be a good opportunity to showcase some of the things that you're doing and some of the things that you want to do as far as access and that kind of thing goes. So I see that as positive change, positive opportunities, and really opportunities for stakeholders to get together and have conversations that can kind of move us forward after 6 years of really kind of difficult, maybe stagnation. Not that that's the care that you're providing here, but that the system has been given from Lansing, right? We had massive funding cuts, and then on top of that, we had kind of a systematic threat for really since I've been around you. It wasn't me, I promise. So those are opportunities for you to lead, to continue to lead, but in a positive way, and I think that's great news. The two items you have in front of you are your legislators here in Oakland County. You have, because of redistricting, you have 29 legislators in Oakland County. It's a lot, okay? But it's also an opportunity because you have 29 people who care about Oakland County. If you look at the House of Representatives, and I'll let you go through the packet on each individual, you've got photos and that kind of stuff in there. But if you look at the House of Representatives, the way this works is there are 110 total members of the House of Representatives. You need 56 for a majority. The Democrats hold the House 56 to 54. Very, very slim, okay? There is an opportunity to get things done, but it's going to require help from the minority party, from the Republicans, to do so. I mean, no one can be out sick, right, or else they lose the ability to govern. This is going to be one of those things where I think there's a lot of pent-up energy on the Democrat side to do things that have kind of been waiting in the wings to do now that they've got the Senate, the House, and the governor's office. But I think that it's going to be a little slower than some of perhaps the folks that folks would want them to go. Okay, so I think there's going to be some growing pains in the next 6 months in that party where they discover that it's harder to govern than maybe we thought in November, right? Because things are thin and it's going to require more than just who's there, because there's a multitude of different folks within each party. Now, that said, there are opportunities, I think, and you guys have 20 House members alone here in Oakland, okay? You have 11 Democrats, 9 Republicans, and 16 are residents of the county. So only 4 live outside the county and represent portions of districts that come into the county, if that makes sense, right? So their district may cover both Oakland and Macomb, or Oakland and Wayne, or in one case, Washtenaw and Oakland, but they live out of the county and represent that part of Oakland that their district goes into. So only 4 cases of that. So 16 of your state reps live here in Oakland, are residents here, and I think you're going to find, I only split that because I thought it was interesting. I think you're going to find all 20 really care about you and want to do the best that they can for you. So I think those are opportunities. You know, you need 56 for a majority, and you've got 20 already, so that's pretty decent. If you can keep them talking to each other and make sure that your issues become the nonpartisan issues. The Senate is much the same story. Again, you need 20 for a majority out of 38. Oh, there's a typo there. I have 36 on the page. It's 38. So I apologize for that. 38 Senate members. You need 20 for a majority. The Democrats have 20, so it's a 20 to 18 split there. Again, can lose 2 votes in the Senate because the lieutenant governor can break a tie, just like the federal Senate. So in this instance, you have 9 total members, 5 Dem, 4 Republicans, and 6 of them are residents of Oakland County. So again, similar numbers to the House. It's a huge number. You have a great many representatives, and the challenge is going to be staying in touch with all of them. But, you know, I think through your efforts, given the efforts the last 6 years, I think you don't have problems with that. I think we just need to stay on top of that and make sure that those relationships are there, continue to be forming, et cetera. So we just need kind of the board to be active in making sure that those relationships are present. So get to know your representatives. If you don't know who your representative is, find that out. Get to know them and talk to them frequently. There is one issue that I want to bring to your attention. That's remote meetings. I think that there's an opportunity to get that done probably this year. I know that that was something that was greatly beneficial to this board during the COVID crisis, and something that I think within reason, with the proper guideposts, you know, can be done in a reasonable and decent manner, and still make sure that the public is part of the discussion. So I would think that that would be a thing that we can work on and probably get done, so that, that's an opportunity as well. Other than that, we're gonna make sure that we get, Dana and her executive team out and, meeting folks. And we'll start that with the legislative breakfast coming up on the 30th. We've got great news there. DHHS Director, Elizabeth Hertel has, indicated that she will be here, that day, which is great news. I told her it would be, she would be among friends, and we would talk about how to move the system forward together, and it would be a very positive experience. So I think that's great. It's a huge coup, you guys. I think you should be proud of that. After that, it's just making sure that we get to know folks that are on the committees that Dana needs to know in order to be able to educate, and that we move forward with good ideas, and that you're controlling as much as you can the discussion going forward on behavioral health. That's what I got.
Thank you. Before the election, you mentioned there might be a senator who would carry on the Shirkey message or the Haberman message. Is that senator still an issue?
I don't think it's going to be an issue.
Okay.
I talked to a Republican in the Senate about that specifically, and they indicated that they thought that would probably not be a thing that we needed to worry about right now. So
Okay.
I'm not saying it's not going to happen. I'm not saying it won't be reintroduced. But I think
Dying committee kind of
it
thing?
was a sound defeat.
Okay. The other is, you were just talking about an opportunity, and I wondered, is there opportunity for us or CMH's PIHPs to expand the persons we serve? So revise the carve-out, carve-in to the mild and moderate mental illness, look at other specialty populations that the state serves through MDHHS, et cetera.
Yeah, I think, I can't speak to that specifically, but I can say that I think anything that will improve the system would be on the table, okay? I think the importance would be to be able to demonstrate whatever ideas there are will improve the system, will improve access to care, will improve a continuum of care, right, going forward. And, I think if that can be demonstrated, I think you've got a chance to do, multiple different things, certainly. Sorry, I couldn't speak specifically to that.
Has the legislature made their committee assignments yet?
Yeah. So, yes and no.
Okay.
They are, I think, probably done. However, they are not public until Wednesday.
Okay.
So I should have told you, Wednesday will be the first official session day in both houses.
Okay.
They will make official votes for leadership, although they did those right after the election.
Right.
They'll make those for real now that everyone's seated. They'll pick chairs in the chamber, all that stuff. And then they will receive their committee assignments on Wednesday as well. So we will know the makeup of those committees so that we can get started meeting folks and that kind of thing. But Wednesday will be the official date.
And then do the committees make their own subcommittee appointments? Is that how that works?
I don't know whether those two subcommittees will, I assume that those will be appointed from the speaker, but I don't know that to be true.
Okay.
That's an assumption I'm making.
And then, you mentioned a housing subcommittee. Is that, that's specifically for, would that be with group homes and other types of homes?
I think it's more about, housing access. So not necessarily, I think it's important to discuss housing for the populations that you serve as well, but
Right.
I think mostly that's gonna be, renters, landlords, that kind of
Affordable
thing.
housing, workforce
Yeah,
housing.
exactly.
Okay, I get it.
Yeah,
Okay, I got
exactly,
it.
right,
Okay.
yeah.
All right, okay, thank you very much. And thank you for all of your efforts. Don't undersell what guidance you help provide to all of us and you and your team. We really appreciate it.
It's been a
Thank you
great
very much.
pleasure.
Are there any other questions? Yes, Christina?
Thank you. I am super excited to hear about those behavioral health and housing subcommittees. Sounds like it's going to be really important for us to stay connected to them and go and present and be as, just be as involved as we can with that. So I was wondering, you said Wednesdays when they should announce who's on it. Can we make sure we send personal invitations to our legislative breakfast to those who are on that committee? Okay. And I thought I had another question, but I guess that was it. Yeah, that's it. Thank you.
All right.
Are there any other questions? Not hearing any. Thank you so much for your wisdom, knowledge, and understanding and guiding us through
Thank
the
you.
maze of Lansing.
It's always a pleasure to be here in Oakland, not in Lansing. Thank you very much.
Next up on our agenda is quarterly compliance update with Marquita Massey.
Good evening, everyone. I'm here tonight to give you an overview of what's going on with compliance here at OCHN. Specifically, I'm going to be talking about activities from quarter 3 and 4 of fiscal year 22. So in our contract with the department, there are certain elements that we have to ensure that we address through our processes that we have in place here. It's fed down to us from the Code of Federal Regulations. We have to have written policies, a code of conduct, a compliance officer and oversight, training and education, reporting hotline, monitoring processes, the ability to investigate and correct any findings, and disciplinary policies. So in terms of what we have in place to address those areas, in terms of written policies, we have a very comprehensive corporate compliance policy and also code of ethic policies. Our policies are reviewed and updated at least every 2 years. We also have a compliance officer, and we have our compliance committee. Our compliance committee meets every quarter here at OCHN. Also, throughout our network providers also have a compliance committees and compliance officers. Training is required of staff annually. Our training is in Docebo, and as issues arise that maybe rise to the level of needing more targeted training, we discuss those things at our general staff meetings. We have a reporting hotline. We have a form on our website for any interested parties to be able to report out to us any issue of concern. Any incident reported to us is investigated and remediation is applied. And of course, if a situation warrants any type of disciplinary action, that is also completed. What this slide here shows you is a partial screen snip of the reporting form that's available on our website. The previous slide documented the path to get to this on our website, but if you were to go here or any interested stakeholder, they could go to this spot on our website and complete the form. It would come here to OCHN. We would review that and determine if would investigate and determine if there's any need to substantiate the issues. A little bit more on how we meet our requirements. I spoke a little bit about our corporate compliance policy. Our policies can be accessed through PolicyStat. Our policy is very comprehensive. It covers details on our compliance program and all the different activities that we're responsible for ensuring occur. When an issue is reported, it's investigated and assigned to staff to review. It may involve staff interviews, review of records, and it may also involve digging a little deeper and conducting audits. I talked about the training process that we have in place for staff, and our training is in Docebo. Annual training is also required for our network staff. We audit for that to make sure that that's happening. We, in terms of reporting sources, we have our website that I shared the reporting form to you. For internal staff, we also have a form on our intranet that staff are able to report any issues to. In our contract, it requires for our network providers that issues are reported to us within 48 hours for investigation, and they are also required to report out to us the outcomes of those investigations. Here internally, we also have Power BI reports that we use to conduct some of our data mining activities. Most of our reports that pertain to compliance come from those Power BI reports. However, we also do receive issues and concerns from staff and providers, and then we also receive issues being reported from recipient rights. I spoke a little bit about our quarterly compliance committee meeting. At those meetings, we review all the cases that have been reviewed that have been presented to us during the quarter, consultation on cases, and then deliberation. On our compliance committee, the staff that sit on that committee would be our CIO, our CFO, our Chief Compliance Officer, myself, the HR Director, the HIPAA Security Officer, the HIPAA Privacy Officer, and the Director of Recipient Rights, and also our COO. I think I have everybody. I don't think I forgot anybody. We can move on to the next slide. On a quarterly basis, we have to report our compliance activity to the state, to the Office of Inspector General. So what this table here shows as a summary of issues that were reported in quarters 3 and 4. So that may be a little small, so I apologize, and it's even small for me on my slide. So what I can tell you is that in quarter 3, there were no tips or grievances reported. In quarter 4, there was I think that's a substantiated issue, and there was a corrective action plan that was required, and a category for tips and grievances. The next category pertains to data mining, and that's an area that looks at overlapping services, or maybe services that have been reported after a person has expired, or another scenario would be reporting of a CPT code that's a time-limited CPT code, where our reporting shows that a provider may have reported billing for that service longer than accepted. In those instances, we would issue a corrective action plan and recoup the funds. Let's see, the next category is audits and OIG referrals. In the past 2 quarters, we received quite a few referrals from the OIG. The OIG has new staff on board there, so there's a lot of activity that's happening there. They're catching up on some cases that were a couple of years old. The first few bullets there were unsubstantiated. The last one was, the 4th bullet there was a substantiated issue, where funds had to be recouped from the provider. I think the staff was terminated, and the provider was requested to submit a corrective action plan. The last category that's here is explanation of benefits. So what that is similar to what any of us receive when we receive services from a provider. You receive a notice from your insurance carrier saying, basically, did you receive these services in this quarter? These are services we've been asked to pay for. we, assumed that role here at OCHN in fiscal year '22, and we've sent EOBs out to the network for, all of, '22. Before we did that, we, engaged with person served to make sure that the notice that we were going to be sending out, if it was, clear and understandable. We did receive feedback from the, Citizens Advisory Committee, so we made some changes based on that. But so far, we have not received any issues or concerns in response to the explanation of benefits notices that are sent out quarterly to the network, persons served by the network. So our contract requires that we send out the EOBs to 5% of persons served. So we will continue to do that and educate our persons served and the network on that process. So what this slide basically covers are other, well, I'll pause there and find out if anybody had any questions about any of those items. Current procedural technology. So those are the billing codes that are attached to claims. Sorry about that. We should define out our acronyms. So the first one, what's on this slide are other types of compliance issues that have been reported to OCHN that we've had to investigate. So the first one would be our electronic medical record / ODN controls that are in place in terms of ODN. Some examples of some controls that we have in place is one where a practitioner can only bill and sign for services based on the credentials that the individual holds. So if they don't have, if you're not a nurse, you couldn't bill for medication reviews and that sort of thing. So we have the procedure codes that would, in ODN, that would prevent an individual from billing for those things that they're unqualified to do. We also have time overlaps. So all billed services have to have a start and stop time. So staff can't bill for services at overlapping times. And then there's also a control over death dates. So once a person has expired, claims would not be able to be submitted, they'd be rejected. In terms of provider and staff education, I spoke a little bit about annual training that's required of our network and our staff here. Board members also complete annual training. And then also during our general staff meetings, if we're seeing like an influx of certain things where there seems to be a trend, then we address that at our general staff meetings. Telehealth surveys. Right now, a lot of services are being provided through telehealth, and we want to be sure that those services are being provided. MSET conducts a follow-up survey on a sample of persons served, basically just calling them, asking, did you receive this service? Do you remember how long you spoke with the person? Were you satisfied with the services? So far we've been doing that. I think we started that in fiscal year, right midway in the pandemic. We're getting a little bit of activity from folks from that, but so far we have not had any instances of fraud coming to us from those surveys specifically. Let's see, in terms of self-directed services, that's an area where there are, we get a fair amount of activity from issues being reported to us from that category. So in terms of that, we're having to have the providers do more focused training on with the EORs, the employer of records that are actually approving those timesheets, to make sure they understand that you're signing off on this timesheet. So by that, you're saying that you actually receive these services and we are paying for these services. So just educating the person served on the importance of making sure they're only approving services that they've actually received. And also the supports coordinators out in the network are taking a more intense view of reviewing the CLS logs when they're out in the community connecting with people. We'll move on to the next slide. So some other items that come to our attention quite often is the items listed on this slide here. Our staff are very good and very knowledgeable about what is a violation. In terms of HIPAA privacy, we've had instances of staff sending emails that aren't encrypted. Any email that contains PHI, protected health information, has to be encrypted. We've had some instances of misfiling of information in an incorrect person's record. So when these kind of issues happen, they're reported. The staff person's supervisor is made aware to counsel the employee. If an employee has a repeated instance of this sort of infraction, then the employee would be required to complete another training. And of course, if these kind of things continue to happen, then there would be increased disciplinary action. We've had a issue reported in terms of ethics integrity complaint from a provider staff inquiring about the pass-through of the direct care wage increase. That complaint went to customer services. We had to investigate that. We requested payroll records from the provider to confirm that the direct care wage increase was actually passed through to the persons to the direct care staff. And in this instance, the wage increase was actually passed through. The last item that you see here is an attempted breach. We've had some phishing attempts that have come to OCHN where I guess you could call them bad actors. They're out there sending bogus emails asking for a change in account information. Our IT department has done a very good job of educating our staff on recognizing what a phishing attempt is. So in these instances, when a staff person receives an email that looks suspicious, they contact our help desk so that we can avoid any changing of information that will result in payments being misdirected to an incorrect body. So right now, on a monthly basis, IT is giving a prize to staff that have been identifying phishing attempts to really continue to increase the awareness of what a phishing attempt is to protect the organization. This next slide just covers some additional actions that have been taken to ensure that we're operating in a manner that supports best practices. So I spoke about training extensively in regards to what we're doing to ensure the protection of protected health information. We've, in terms of our residential providers and overlapping services, we've issued corrective action plans to network providers several times in regards to overlapping payments. So they've had to submit corrective action plans to us, and some of the actions that they've implemented is including additional verification checks prior to, submitting their billing to OCHN, and also reviewing the leave of absence logs to ensure that the persons were actually, there before the services are being billed. In terms of billing verification checks, these are post-payment reviews that are done. We've expanded the volume of our billing audits that have been done. In fiscal year 21, we contracted with a new vendor, which allowed us to be able to expand the volume of claims we reviewed to ensure that claims that are being paid were actually, the services were actually rendered by qualified staff, and that they're authorized in the plan. In 2020, we were only able to review 265 claims. In 2021, once we started contracting with the vendor, we were able to review 492 claims. And then in 2022, there was a sample that was selected from a population of over 191,000 claims and 426 providers, and 2,500 claim lines were reviewed. So there was some recoupment that we did have to make in regards to that. It was not a substantial amount from what I recall, though. Let's see. I mentioned how we're going to continue to issue the explanation of benefits to individuals served. That has been identified as a method for identifying any fraudulent services that have been reported that were not actually provided. To date, we haven't received any complaints from individuals yet. And if a provider continues to receive repeat citations in the same area, we would meet with the provider leadership to discuss the issue with them, try to identify what the barriers are contributing to the performance, and in some instances we've had to implement referral moratoriums. So we can move to the next slide. And that's the last slide. Are there questions that I can answer?
Thank you. I appreciate the effort you guys put into doing these, and I know how dry the topics can be sometimes. On the last page, you were talking about claims and billing, fraud, waste, and abuse, FWA, kinds of things, and I wondered how it's hard for members, all of our members don't get explanation of benefits, EOBs, so how is it's got to be hard to get requests or concerns from members thinking that our persons we serve are getting, that we're overpaying for some of the services performed. What are some of the other things you guys have in place to do that 2,500 claims and other things?
So the 2,500 claims, that was a task completed by our contracted vendor, where they did the Medicaid claims verification reviews. So we'll continue to issue the EOBs to persons served. That's really what we can do. We'll just keep doing that, making awareness to persons served. Right. And then we also publish, like I said, we have information on our website where where any interested stakeholder can find out and apply and submit any concern that they may have to us for review and investigation.
Okay. I was just wondering if we ran any data analytics, and I see Nasser in the back over there, but anything that does some analysis ourselves to see if we can spot things that might not otherwise be picked up. Sure.
So I mentioned the overlapping services, the CLS services. If a person can't have overlapping services, if you're in the hospital, you can't be receiving CLS services. You can't be getting partial hospitalization services. If you're in a residential service setting for behavioral health, you can't also be getting SUD residential services. So we do data mining in that respect. I mentioned the data mining for services after death that we do. I also mentioned the time-limited procedure codes that we look at in terms of our data mining.
Nestor's coming up to provide some additional content. Thank you.
Good evening, Nasir Dawes, Chief Data Officer. It just happened this week. I was talking to my team about some data mining about what the state call it duplicate threshold. They publish the HCPC code chart with some standard number of units, sometimes per day, per month, whatever the case might be. What's really funny is if you exceeded that, the system accepted, and the state system accepted as well. But at the end of the year, when Milliman, which is the actuary, compute your capitation, they threw that away. So you pay for something, then you don't get reimbursed for that. So this is one of the things that I am interested to see how much we have, if any, of that.
So we'll be able to do some spotting of highs. I know in the past we've done analysis on members that are high risk and have high amounts of services, and we're trying to help them work the best way for services. In this case, it's identifying the providers that seem to have unnatural numbers of units billed and things like that, to say, well, they have 10 people on their staff, how can they do 5,000 hours in a given month?
Absolutely.
Okay. Just always wondering. Thank you.
Thank you.
Are there any, oh, go ahead.
When you talked about the overlap in billing, is that generally between medical and clinical?
It's generally between inpatient, so somebody's in a psychiatric hospital, and there's also a billing submitted for residential services. That would be an example of that.
Okay, thank you.
Are there any other questions?
Oh, question, yeah.
John Paul.
You mentioned under the ethics and integrity that there was a complaint about direct care pass-through, and that so we verified that. How do we go about doing that, verifying that?
That was done through staff interviews with the person served, and with the family members. So a lot of it is recall.
All right, thank you.
Are there any other questions for Marquita? In reference to the question that John Paul just asked, that mainly takes place with the self-determination contract?
Yes.
Okay. All right. Thank you.
Thank you. Okay. Thank you.
Next up on our agenda is Christine Burke with our revised vision statement.
Good evening, everyone. Happy New Year's. In November, I believe I mentioned to the board that we were revising OCHN's vision statement. I believe the request for this revision came from the board bylaws committee to Dana. The first step we took in this revision process was to have an open dialogue and conversation with members of our Recipient Rights Advisory Council. They gave their thoughts and changes they would like to see in the vision statement. One of those was, and you have both the current and the proposed, one of the things they really wanted to bring forth was that they wanted to see OCHN recognized as a champion and advocate for them, for empowering them, that they wanted that in the beginning. They also mentioned changing mental illness, and so we made that change to mental health concerns, and then for them to lead independent and self-directed lives. So after that dialogue, I brought back the draft, presented it to them. Next, I presented it to the Citizens Advisory Council and let them know where we were in the process, that we started with our RAC. Malkaya was at that meeting, and we did change individuals to youth and adults in the statement. The statement was also presented to our chiefs,
and then it is being presented to this board for its approval. And that process after, once it's approved, and if you do have any changes, we can make those modifications. Then we'll put together a plan on revising any of our printed materials, our electronic materials, and then promoting awareness about the change to the vision statement and why we made the change. Are there any questions?
Thanks. I like the new statement. So here's one concern.
That's okay.
This is what I deal with son with autism. So in the top one, it talks about achieve the lives that are important to them. The second one, providing opportunities for people to lead independent. Joseph Young is never going to be independent. So, and I know that's a big push. I mean, I literally deal with it all the time. So I just want to be careful with that it doesn't, you put Joe independent and in a week, he's dead. So I struggle with that.
Let me ask you this. What if we put lead independent with supports? I think when we talk about independent lives, it doesn't necessarily, and I see what you're saying, right? That's why we have these conversations. It doesn't necessarily mean that he or she is in an apartment or in a home by themselves, but with supports to lead life.
I think there's people that are outside of our world, especially folks in Lansing and Washington, that see pretty pictures or nice videos from national organizations and think, with enough stuff, anybody can be that. That's just not true. And I want to be careful that we don't endanger lives by creating false expectations.
No, I appreciate that. So if we could say for people to lead independent and self-directed lives with support.
Yeah, or to the extent they're able or something. Yeah, just, I mean, that's why they call it a spectrum. Every day is different.
I can make that revision and get that to the board. I think that does make sense to me, if people live independent and self-directed lives to the extent that they are able with support. Okay. Does anyone else have any input? I appreciate that. Thank you, John.
I was thinking maybe taking out the word needing in the first section and maybe using seeking, because to me that sounds a little more empowering. You're seeking it versus you're needy.
I like that suggestion. And I know for the people we serve, the priority of the people that were on the RRAC and the CAC was really one of their objectives is making sure that we were recognized as an agency that champions and advocates for them to empower them to achieve lives that they want to lead with supports.
Are there any other, Adam, I'm sorry.
Maybe instead of with supports, supported lives, incorporating the phrase supported lives somewhere in there. Instead, it just sounds simpler. I don't know.
All right. I will make these changes, and that's why we bring it to the board to look at after we have the people serve. I think as much input as possible is helpful, so we have the right vision statement when we start to share it with the community, and I'll make sure Sheila has that to the board to review.
Yeah. Can we read out the suggested changes, and then is it possible to make the motion for approval, or do you guys want her to revise it?
I'm looking at you, you looking at me.
I think we could, I think your committee could, move it along and say, to come back to the board with the statement, with revisions as suggested.
Yeah.
If we could do that with your committee. Thank you.
Thank you, Dennis. So, should we do the motion first and then do the discussion? Wouldn't that be proper? Okay. I would entertain a motion from the policy committee that we move the recommended changes forward to the full board for approval.
Support.
Well, I can't make the
Well,
motion.
I make a motion that we, take the recommended changes that have been suggested in today's meeting and move forward with that, once you bring it back.
For the board meeting.
Yes.
I'll support that.
Thank you. It's been moved in second. Are there any questions or discussion on the motion? Jonathan?
So we're gonna hear it in its correctiveness right now, and then your committee's gonna vote on recommendation to bring it to our board meeting for next week?
Yes.
Okay.
Okay.
Then if it's possible, for my question, can you read the revised, vision statement now to help? Thanks.
Yes, I can do
With
that.
the changes?
Yeah.
Okay, thank you.
So OCHN will be a champion for the empowerment of persons seeking quality integration of physical and mental health supports and services. This includes youth and adults with developmental or intellectual disabilities, mental health concerns, and substance use disorders. We listen and respond to our community's needs, providing opportunities for people to lead independent and self-directed lives to the extent they are able with support.
I'm good with it, but Adam, is that what you?
Adam, is that okay?
I think it would, I think it, the meaning would be the same, but I just thought, maybe it would be a little more, succinct, but I'm trying to figure out how I would incorporate the phrase, supported lives in there, but I mean, in terms of the meaning, I think it's fine.
I have a suggestion, perhaps instead of putting the word support at the end, put, after communities needs, providing support and opportunities for people to lead independent and self-directed lives. Does that make sense?
Sounds good to me.
Does that make sense to you, John? I know that to you want to
Yeah.
say it in there to the extent that they're possible. So yeah, we can do that. So providing support and support opportunities.
No, support and opportunities.
All right, let me reread this then. OCHN will be a champion for the empowerment of persons seeking quality integration of physical and mental health supports and services. This includes youth and adults with developmental or intellectual disabilities, mental health concerns, and substance use disorders. We listen and respond to our community's needs, providing support and opportunities for people to lead independent and self-directed lives. Are we good?
Is there any other discussion on the motion? Jonathan?
I think that because you didn't actually put the actual words in your motion before, that I think we're okay with what you've just read for it to be adopted as part of your motion. I don't think it requires an amendment or any other change, but just wanted to be clear on that.
But should we ask our person who made the motion if they're okay with those changes?
I'm okay with the stated changes.
Okay, thank you. Hearing no other discussion, can you call the roll? Sheila?
Ms. Root?
Yes.
Ms. Woodruff?
Yes.
Ms. Newman? Motion carries.
Thank you.
Thank you. I'll make the changes and make sure that you have the corrected draft before the board meeting.
Okay, thank you, Malkiah and the Policy Management Committee. Our first order of business for business operations is to call upon our Chief Financial Officer to go over the September 2022 and November 2022, and just so the public doesn't think we're missing months, we covered October last month.
Good evening. Yes, evening. So yes, we're circling back to September. It accidentally left out of the board packet, I don't know, last month, I can't remember now. So, this is gonna be your very first glance then at the full year of fiscal year '22. So, the chart you're looking at speaks to revenue and eligibility really, because revenue is based on eligibility. So you can see, the full year there. And you can see kind of how that played out. The last 6 months or so were pretty consistent from an eligibility and revenue perspective, as they were the prior year. So that really has a lot to do with the emergency order and the fact that people could not come off of Medicaid or Healthy Michigan during that time period. You can go to the next slide. So this one is specific to eligibles, but again, the number of eligibles determines the amount of revenue we get, so you're going to see some consistency in how that looks. The chart is a little different. You don't see the dips quite the same just because we're talking over 250,000 people. But it did remain pretty consistent from March on. I'll actually mention that in November, but you can go ahead. So this, I'm going to give you the caveat I gave you last month. So this is the first look at fiscal year '22. So much of the year-end reconciliations are not represented in these charts. So when we're looking at this, you're looking at September versus September. So this is going to be September of '22 versus September of '21. So you can see our cash and investments comparatively is down. Receivables is also down. So what that means is we paid out more in this period than we did in the prior period. So our cash and investments was higher, but then also our receivables and are also higher. So other assets is not material in the grand scheme of things. Capital assets we expect to see go down each month and each fiscal year just as they're depreciated. So vendor payables, that's where you see the significant difference in, so it has a big impact on our cash and investments, is that it reduces our cash when we pay vendors. So you can see, as of right now, September looks really low, but what will happen is as we reconcile accounts, we will determine the due to and due from providers. So if we pushed out more cash than necessary, they will owe it back. If we didn't push out enough cash, we will owe it to them. So these do tend to materially change, especially in this fiscal year because of CCBHC. So CCBHC was very kind of up in the air and figuring it out as we go kind of throughout the fiscal year. So we did push out cash for everyone that was enrolled and served regardless of fund source, whereas we will eventually get the cash back for anyone that was not Medicaid or Healthy Michigan because we are not responsible to fund those individuals. So these will change. You can see due to state is down comparatively from the prior year. Employee payables is not materially different. And then long-term debt, yes, is down slightly, but again, that's just related to making payments on the group home bond and the Resource and Crisis Center. Next slide, please. So you can see here total assets is down comparatively, but also so is total liabilities. So those kind of are married to each other. So what that means is our net position is down slightly from the prior fiscal year, but that's to be expected. So this is revenue comparatively from September 21 versus September of 22. So you can see revenue's up quite a bit, but the primary driver in that is really going to be that CCBHC revenue. There was some increase in rates, but not material compared to the CCBHC revenue. General fund revenue was roughly the same. County funds was roughly the same as well. And then all other grants and things like that, as well as other SUD funding. So now we're looking at expenses. So this is, again, year over year. So you're looking at administration. So administration, again, appears to be down from the prior fiscal year. There was an adjustment in how we were booking administration during these two time periods. So that's why you see that material difference. Provider network expenses are up, so this is the key place where you're going to see not only the increase in the direct care wage, the direct care wages that we did, but also the CCBHC expenses are in here. So CCBHC alone was roughly an additional $25 million, I believe, off the top of my head, in expenses and in revenue. In addition to the fact that we did increase direct care wages to $15 an hour in fiscal year 22. So grants are roughly $1 million different. That's just related to some grants we didn't have in fiscal year 21. We did have in fiscal year 22. A good example of that would be the ones we had with the county for Oxford and for the school mental health navigators. All other is not materially different from year over year. And you can go to the next slide. So what that ends up looking like is total revenue is a bit higher. You can see almost exactly to that $25 million I was talking about. Total expenses are also up. As I mentioned, we did expect that. So our net income is down a bit compared to the prior period. But again, we did intentionally push out additional money for direct care wages to try to really boost those individuals' hourly rates. That says top 15 providers, but that's not the chart that's there. So if you can envision the top 15 providers, which we can correct, you'll see it in the next month that I'm going to present anyway. It tends to not change too much. And with that, I can take questions for fiscal year 22.
I did have questions for you before the meeting, and you indicated the same item or same situation, that some of these issues will be resolved with reconciliation at the end of the day. But when would we have 22 fiscal year 21-22 comparison to budget?
So
because we didn't have that in this version. There were other statements.
So you're saying the budget to actual?
Yes.
Is that what you're looking for?
Yeah.
So I'm not sure why that's. So we have the final ones that are audited is when in June those are presented.
Right.
But as far as just the monthly ones, I'm not entirely sure why they're not in there, but we can make sure that that's in there for the.
Yeah, if you could forward to us with the board.
Yep.
Yeah,
Definitely.
information, that would be helpful.
I know what one it is. It's not in there. I'll get it. I'll make sure you have it.
Okay. John.
And I had a question on our reserves. How are we doing with reserves, and how are we going as we're heading towards this year? Are we going to try to build them or reduce them?
So the goal is always to build reserves, and as much as people don't like to hear that, that is also part of the reason we were able to sustain in fiscal year 18 and fiscal year 19. So it is part of my long-term goal for the last year and this year to do so. So in last fiscal year, when I say last right now, I mean 21, we were able to put some reserves back in. That is certainly the goal with fiscal year 22. What I would say right now is part of this is how we are reconciling with CCBHC which is sort of still unknown. Because of the way we're kind of doing this as we go with the state on the reconciliation, we basically have to reprice as if CCBHC didn't exist. And then that is the portion that comes from our capitation. And then the amount that is equal to what we should have paid to CCBHCs comes from a supplemental payment. So there's a lot of kind of moving parts right now, and as we reconcile, I'll have a better idea of what that number is. It is definitely my goal to be able to put some away into reserves from fiscal year 22.
Okay, and as we're now a quarter through fiscal 23, are we marching towards trying to remain even or trying to increase them slightly? What's the game plan with that? And the other is with CCHB. I got the initials wrong, but HBC, aren't their fee for service, or are they capped? They're on now a cap.
It's a PPS one, which is a per payment per day the individual is served. So it's totally different than most of the other structures we're working with, but we're not responsible for anyone that is not Medicaid covered. So again, because this year is our first year, that's kind of flushing out right now. So anybody that ends up Medicaid covered, yes, that's a person we would pay for. anyone that's not is not someone we're responsible for paying for. So that is a big difference from prior years.
Maybe I should ask the second question first on those, since we're only responsible for paying for services for people that are Medicaid covered.
Mm-hmm.
If it turns out they're not Medicaid covered and we incurred those services, how does our provider network stay whole? Is that going to come directly to them from the state?
No. So that is part of the risk associated with CCBHC. So there is intended to be enough cushion in the PPS1 payment that they are able to maintain business for the non-Medicaid population. Now, in fiscal year 22, there were 2 different grants specifically for that population. There may or may not be in the future. That's really up to the state. A lot of it was ARPA funds. So if that's available next year, the state has said they will try to give money for that. But again, because we haven't reconciled all of those yet, I can't see yet what wiggle room the providers had from what they were paid versus what they spent. So that's kind of those pieces that are still very moving parts. It is not our liability, it is theirs. So that's part of the risk they took on in becoming CCBHCs. So that does play out a little differently for us as we reconcile all of this.
So the guidance to our providers are make sure they go to CHAMPS and verify.
They need to be Medicaid eligible. Like they have a very, very big vested interest in people being Medicaid eligible.
So they should make sure they check just like they would if they were dealing with commercial insurance.
Yes.
Okay, thank you.
Any more questions on September of 2022 or year end?
Even with that risk, they still have to take people, right?
Yes, CCBHCs they have, regardless, there's no COFR, there's none of that. It's basically wherever they show up and want to be served is where they are to be served. And so, yes, that is correct.
Just to let people know, it's not like we can say no.
No, that's not how it works.
We have to take them. They have to take them.
So in theory, for the actuary, they have included enough to cover those individuals.
Okay. All right, I think we're good with year end, 22?
22.
Right.
Now we can talk 23.
Right.
So again, same chart you saw the last time. This kind of speaks to revenue and eligibility because they're tied together. So it's consistent with the prior months. And you can see October and November are relatively consistent. Don't worry about December yet, because when these were run, it was early. We didn't have everything. What I want to point out is that we have heard that redeterminations will start in March. So we will be discussing, I believe Wednesday, our start of a conversation about how to make sure that people are getting their Medicaid and Healthy Michigan applications all filled out, and all of that's done in a smooth and good flow way so that we don't get a lot of people falling off of Medicaid or Healthy Michigan. As I mentioned, the providers have just as much vested interest in this as we do at this point, and certainly we wouldn't want that to impact service delivery for any of the individuals we're serving. So I trust, I know Christine will have a very thorough communication plan and thought on how we're going to do this. So we'll begin planning that. I think it was either late last week or very early this week. Wait, today's Monday. It must have been last week that we found that out. So this is just a look at eligibles. I did see Christina had her hand up. I don't know if you want to. Dennis?
Oh, I'm sorry,
Is that
go
okay?
ahead, yeah.
Thank you.
Sorry, yeah.
Just related to that, I was wondering, is it possible for us to hold workshops here and maybe ask our providers or invite them to do the same? So certain days they send out communications saying, hey, call, set up an appointment, or drop in. They're called My Bridges Navigators, the people who are trained in filling out the redetermination.
So I would defer to Christine, but I'm sure that's on her list of things we will do. And we also do pay a couple of, we call them MARA workers, that's what they do.
Okay.
So we pay for them specifically just to make sure that stuff happens and happens well. So that might be part of the strategy. Again, I am 100% confident Christine has that covered.
All right, thanks.
We're also waiting on state guidance because they're working on getting information from CMS and how to do it. And it's a rolling redetermination, so not everybody on a certain day, like March 1st, everybody has to redetermine. It's a rolling based on their annual actual start date of having that coverage.
So it's not going to be everybody all at once,
Yeah.
thankfully.
That helps.
Okay, you guys are good. I'll move on. So this is looking at the end of fiscal year 22 versus November of 23. So you can see cash and investments are down from the prior year. The key right now is because the prior period is not closed. So fiscal year 20 has not officially been closed yet as we do our reconciliation. So the balances and things like that that are going to be brought forward are not currently being done yet. So these are going to be squishy in the meantime. We will have them, I believe we will close the period very quickly. We're just making sure that some of our last minute movements with providers are done, so that account reconciliation has to be final before we can officially close the period, and then it pushes all the balances that need to be pushed forward. So keep that in mind, and I can let you know when they are officially closed so that you understand that these are the real balances for each of these accounts. Receivables is down, but again, I do expect some of that to change as we go through this reconciliation process. Other assets, not materially different, and then capital assets, as mentioned, we always do expect to continue to go down with depreciation. So looking at vendor payables, you can see that's down significantly, but that's one of the things you're going to see go up as we reconcile accounts, where if we owe any providers, we will accrue it, and it will be due to provider, and then when it's paid, it will come out of our cash, is how that works. So in this process of reconciliation, that's where we go through is how much did we pay them, how much did we really owe them, and then any stipulations we have like profit caps and those types of things come into play to reconcile those accounts. So that's all going on right now. Due to state is not materially different. That's primarily state facilities. Employee payables is accrued payroll, and then long-term debt, again, is going to be the Resource and Crisis Center payment and the group home bonds. So total assets down slightly, total liabilities also down, which puts us in a slightly better net position currently compared to the end of September, only by about $2 million. Looking at revenue compared to last fiscal year revenue, we are up slightly. That's going to primarily be due to CCBHC, the enrollment with CCBHC being significantly higher at this point. And I would attribute the majority of that increase to that. We have had some increase in eligibles, but it's not material. And then also the rates did go up slightly, but that was really just as it relates to the number of individuals eligible, and a couple of the rates did increase. General fund is roughly the same, county funds the same, and then all other, again, roughly the same. So you're looking at administration. Comparatively, they're very close to the same between the two fiscal years. Provider network, again, we do expect those expenses to be significantly higher between CCBHC and our continued push for direct care wages. Grants appears to be down right now, but as I've mentioned before, grants are have a bit of timing difference where we have to get reimbursed for grants as opposed to getting like 1/12 each month. So they tend to not be an even 1/12 every month. And then all other is roughly the same. So total revenue is up, total expenses are also up. So our net income for this month is a bit down compared to last fiscal year. This is actually the 15 top providers paid. And with that, I can take any questions on November.
I have one for clarification. When you talk about long-term debt, you talked about the RCC and the group homes. So wouldn't this building be included in that too?
No, because this building is paid off.
Oh, okay.
Yeah, we paid it off a few years ago because it didn't make sense to pay interest when we had the cash to pay for it.
Right.
Yeah.
Okay.
So no, it's not included in that, but that's a great question.
Thank you.
And we have 9.5 years left on our lease in our bonds with
I think that's roughly where we're at with the
Crisis Center.
Resource and Crisis Center. Yes.
Yeah. and we'll see what they do to us
Yes,
then.
we'll see.
And just while you were speaking, when will we be closing out year-end, at least on a,
Well, so officially, the audited financial statements come to you in June.
okay,
But
right.
we will close from accounts moving, probably within the next month or so at the longest. And I'm giving myself a lot of leeway there. I think
Right.
we are intending to have no more movement, by the beginning of next week.
Okay, thank you.
Yep.
All right,
All right, thank you.
thank you. The next item on our agenda is a transportation millage update. In November, the voters of Oakland County approved the transportation millage, which in the first year is going to generate $66 million of funds. And I know the county is getting organized, and it's going to provide a number of services and some new services, but also to provide flexible transportation for seniors, people with disabilities, and veterans who need to make essential trips such as doctor's appointments and grocery shopping and things of that nature. So nobody's assigned to this, Dana, so you get it. Unless you've got somebody to, okay, all right.
Yep. So
Go ahead. Sorry, Adam, your name
No.
wasn't next to the,
That's
okay.
all right. I was ready to jump
All
on
right.
the fly here. Just a couple quick updates for you. So we did reach out to the Board of Commissioners, and we do have a meeting scheduled for the 17th, which is next Tuesday, I believe, to meet and discuss the transportation millage and how we can interact on that. So that's coming up very soon. So thank you to the team for helping to schedule that. We also have information that is coming out, a little bit more detail about the millage. And this is good to get the early information because we can start getting this out to the supports coordinators and the clinical teams, so they know what resources are available to our members, what those expanded resources are going to look like a little bit more. So we'll be freely passing along information as it comes in. And I mentioned before, it's going to be, transportation is one of our chief priorities, so it's something we're going to be continuing to monitor, as well as working with the PNT department to have it under that area, so we can just better monitor the codes and the rates and the providers, and assuring that we've got real good accountability for this topic.
Okay. Thank you. Any questions? Yes.
Yep, and this probably isn't resolved yet, but as you meet with the county commission, and I know the county executive office is also hiring individuals, hopefully those two groups will work together. So my question is kind of a practical one, and let's pick OPC, that area, since that's near and dear to my heart. So is there going to be a coordination between public and private services? So like a worry-free or an all-aboard and the services that OPC providers, it's still going to be candid and say fragmented?
Yeah, that's a great question, and I don't know if we know that yet, but one thing that I always like to look at is the customer service experience and how easy is it for someone to access these services. So I'm always going to be pushing towards, let's integrate as much as we can. Let's make sure that the user experience is really easy for the customer. So I don't know if we can answer specific questions like that yet, but it's definitely going to be in the back of my head.
Okay, thank you.
Anyone else? Just two comments. I see maybe two items here of importance, and one is how do we communicate these options to the vendors we work with, and then just the consumers and people in the community who need to use these services and what new options may be available. So that's very important. But the second would be how that millage, some of that funding could help supplement the transportation requirements that we have. One thing I'm concerned about is with enhanced revenue, that we might have people who are in the private system that we rely upon get hired into the public system. And then we have the same problem we have now fighting that battle. So I don't know how much of that will happen. It's hard to speculate, but I just want to make sure that the questions being asked of, you know, how specifically, what you all see internally, what could be used to supplement. And then lastly, my guess is gonna be the county's gonna establish some policies regarding usage, and especially with the dial and reserve. And I think we need to be part of that. It sounds like we will be part of that discussion. That's probably gonna happen not with the commission, but with the county executive and the department that's created. So if we would just make sure we can have those opportunities for transportation as flexible as possible, I think that would be important.
Yeah, we're gonna start that conversation next week, and we'll push it forward.
All right. We should probably find out at the commission level what committee is gonna handle this, transportation, funding and appropriation. So if we could find out from them, because this is a new department that the county hasn't had before. And the commission has the oversight responsibility for these funds. And they have pledged that they are gonna oversee them, and there's gonna be transparency and audits every year and dashboards and things of that nature. So, okay, thank you.
Thank you.
Anyone else? All right, thank you, Adam, and good luck with those meetings.
Thank you.
All right, that is the end of the business operations component of the committee of the whole meeting. So now we're on to other business, the CMHA Winter Conference Board attendees. Jonathan? Sheila? Well, that's passing the buck.
So I do have one confirmation for board attendees, but we do need to get people registered in rooms. We took the liberty of reserving some rooms and some board members' names just so we can hold them. So if you get a notice, don't panic. We're just holding the rooms so we can.
Could you remind us dates and where?
Yep, it is in Kalamazoo, and it's
6th, 7th, 8th?
Yep, 6th, 7th, and 8th of February.
6th, 7th, and 8th.
So, Monday, Tuesday, Wednesday?
Yep. So I just need, Ms. Lazenby will be there as well, some of our executive staff. So I just need confirmation on what board members, so we can just finalize the details, what board members plan to attend.
Okay.
And Jonathan, I'll defer to you. Are they going to have an executive meeting or that our board members need to attend?
I believe there is some delegates that we're gonna need to assign,
Okay.
so we'll need to do that as well.
Mhm.
So we don't have to try to slip them in at the last minute.
Right.
We don't like that.
So if you can reach out, Ms.
Okay.
Newman?
Yes, okay.
I plan to go.
Okay.
So definitely, it's not as exciting as going up to Traverse City, because it's Kalamazoo. But, I can tell you that there have been sightings of a famous singer, so perhaps if you come to the conference, you might see that person too.
Well, I spent 5 years in Kalamazoo supporting a child going to school, and there's a lot of great places in Kalamazoo. I paid for going to all of them, but that's okay. I'll share that list with you. Okay?
So, if you guys can just email me, by
Okay.
Wednesday.
Wednesday, okay.
Yep.
All right, that's the deadline. All right. Thank you.
Mhm.
Anything else on that? All right, next, for a overview on events and outreach, Suzanne Weinert. Welcome.
Good evening, everyone, and Happy New Year. We definitely started the new year off right. We had a great event today. New Year and our first full week back to the office, and it was, today is actually Law Enforcement Appreciation Day, and so we held our Law Enforcement Appreciation event today. It was a luncheon. We had approximately 50 of our law enforcement partners here, and it was just a phenomenal event. It was great it's actually our first event back. I think our last one was in 2019, so it was nice to have those partners here with us again. And we did honor a couple of our CIT, so Crisis Intervention Team, awardees. We had CIT First Responder, as well as the Law Enforcement Executive Award was presented today, and acknowledged all of the departments that came today. We had at least 10 different departments, but big groups of people came from some of those departments, so lots of pictures, and we'll be putting a press release out about that as well. So it was a great event. We were really thankful to be able to host it here today, and thankful for board members who were able to attend. Also wanted to mention that Leadership Oakland is holding their health committee, and Adam is going to be presenting at that next week. Apologies for flipping your name a little bit there. I didn't mean to misspell it, but he'll be presenting at that committee next week on January the 18th. Also wanted to mention that the point in time count is coming up at the end of January, and we are going to be, that is part of the Stories That Inspire Hope next week. So you'll learn a lot more about the point in time count. We do have an individual served that's going to be speaking. We're verifying that confirmation for her to speak, but we're hoping to have an individual speak as well. So you'll learn a lot more about the point in time count next week. Ben had already mentioned the legislative breakfast that's coming up at the end of the month. You should have received an invite through Boardable as well, so we hope that you can all attend. That's a great opportunity to meet new legislators, talk about the new goals, all the things that Ben mentioned earlier in his presentation. We're also resurrecting our advocacy meetings. I'm hoping to host that at the end of February, and that's an opportunity for us to start talking about some of our focus areas. We're hoping to determine between 3 to 5 of our focus areas to focus in on our advocacy, again, along the lines of what Ben was talking about earlier this evening. Also wanted to mention, we already talked about there's the Transition Council coming up. We'll be participating in that on February 1st, as well as we do have a number of our leadership speaking at the winter conference, the CMHA conference, coming up in February as well. And I'm really pleased to announce that our OCHN is sponsoring, it's part of the Canine Support. I believe you've met one of those. Canines was at one of the board meetings. So OCHN is going to be sponsoring one of those canines. Her name is Hope, and we're hoping that she will be able to visit you at a board meeting sometime soon. We do hear she might be coming to our staff meeting next week, so we're hoping staff will be able to meet her, and then eventually you'll be able to meet her as well. Also wanted to mention some of the press releases. We have quite a few press releases that are going out in January. It's just not as, we don't get as much coverage if we do those in December, so we kind of hold those off until January. One press release that we were just part of, you've learned about Dr. Pozios' participation in the JARC, which is the Jail Reform Advisory Council, and that report was released recently as well as a press release, so look for that in the press clippings for January. We'll include that for you to review. Also, your name was spelled correct this time. Adam's COO announcement will be released this month, as well as releasing the names of our new SED providers. And then OCHN was honored with the Mental Health America's Bell Seal for Workplace for Mental Health Award, so we'll be putting a press release out about that, as well as the SAMHSA Community Mental Health Centers Award, so we'll be putting a press release about that recognition as well. And that's all I have. Do you have any questions for me?
Jeff? Not so much a question, but Anya mentioned about kind of the communication plan rolling forward. Receiving info from the state on a fairly regular basis, I would not rely much on them. I think y'all are going to need to do it. One, it's incomprehensible. Mm-hmm. Two, trying to track back to anything that resembles a human is impossible. So I think given the shock that's going to come when people don't fill this out and they're going to contact first-line provider and then here in our website, I think we're going to have to take the initiative. So I know it's March, I know it's only 1/12. My prediction from what I've experienced is it's going to be rough. Mm-hmm. And people are going to be frustrated and angry, and they're going to go to the first place that they can reach, which will not be the state. So I think that the sooner maybe we can see a thumbnail of that plan, the better for everybody.
Yeah, we appreciate the advice. We've been discussing it as well, and trying to work through some of those plans on our own a little bit. Thank you.
Okay. Melchiah?
I just wanted to add that I'm gonna be doing a workshop at the, conference too, the one concerning persons served on boards. And I really wanna change the name of it, but we haven't figured it out yet.
That's great. Thanks for providing that.
I think we're good.
Great. Thank you
Thank
so
you
much.
very much.
Have a good evening.
Okay. That brings us to the conclusion of our regular order of business. At this time, we have a second opportunity for public comment. Do we have anyone online?
Nothing online.
Nothing online? Anyone else who wishes to speak? There being no one, we'll move on to board member comments, and we'll start with Mr. Torres.
No comments, thank you.
Melchiah?
I just want to thank all of the staff for the usual splendid reports that they give us every month. And I also want to acknowledge that next Monday will be Dr. Martin Luther King's birthday. And just in keeping with his dream that we would all walk hand in hand. And I'll leave it at that.
Thank you.
I couldn't think of one.
My only comment is, for the compliance report, thank you. I know how difficult that is to pull together and how challenging some of those, stats and issues are, so we appreciate the work that goes into that.
Yvette?
I'm piggybacking on what John just said. Marquita, that report is very concise for quarters 3 and 4. I know a lot of work goes into that. And thank you and your staff for combining that.
John? Thank you. So a couple of things. Again, reminders coming up. Board members, you probably received email notices that it's time to do your compliance and your conflict of interest and your recipient rights renewals, the annual renewals. Please make sure you do them so that we as a board stay compliant. Think about our earlier discussion, and please join Melchiah and I in Kalamazoo for the winter conference. Let's see. A couple weeks ago, I did visit with the Taubes. He says hello to everyone. He thanks everyone, board, staff, everyone. He misses everyone, but thanks you, and thanks everyone for that lovely recognition piece. I want to thank everyone. We're moving into a new year. We are in the new year. Gosh, I'm going to start thinking about saying 2024. Because in a few short months, we'll be in the new fiscal year. So appreciate everyone who comes to these meetings. I appreciate everyone that listens. And for all of us on the board and the staff who actively works with the folks that serve the persons we serve. So thank you.
Thank you, everybody, for putting together all of your information, especially first full week back. It's a lot of work to get all of that done, so we appreciate it. And Happy New Year.
So I don't sing like Malchiah, but I do have a short story I'd like to share if that's okay. And if you can't tell, I'm really introverted. So this is strange for me, but I do feel like it's inspirational and it can give us a boost of energy going forward with our meetings for the new year. So if you see on your House of Representatives list, you can see that our new speaker is Joe Tate. And I was actually his intern a few years ago through my social work master's program. And seeing his name here reminded me of this story. So my first day in Lansing, someone was showing me around the building, and I promise this was not Joe Tate, so don't go share this as gossip. But someone random was showing me around, and they asked what I was in school for, and I said social work. And they looked at me kind of confused, and they said, "Oh, well, why are you here then?" Because I'm guessing he was assuming I was going to say public policy or public administration, something like that. So I paused for a second and very kindly explained how social workers can be involved in government and advocacy. You know, there's Stephanie Chang, Debbie Stabenow, right? She got her degree in social work. So instead of being super offended by that, I took that as motivation, right, to stay involved, to be an advocate when I can. And it just made me smile remembering that today in this meeting, because I'm at this table with all of you, and I'm so grateful for that. And I feel like we should be excited that we're here, right? This might be a small table compared to maybe being in Lansing or in the Capitol in D.C., but this is an important table, and we're doing amazing work. And everyone who supports this organization, this community, the county, just remember your why, right? For me, it's my career, social work, and everything I've gone through in my personal life. That's why I want to always try and sit at tables like this. So I invite you, just reflect on your why for this new year. Really connect with that so we can connect with each other a little bit more this year and stay focused and serve our people. But yeah, thank you for listening.
Adam?
I can't follow that. Have a good night.
You're a good man. You know when to quit. I just want to commend everyone for the event today, for the law enforcement. Coming from a law enforcement family, we don't say thank you enough, and I think that's very important. I appreciate the fact we had that event. Secondly, I want to thank Ben at Capital Services again, and thanks for staying for the whole meeting. You'll still make it in time for kickoff. For those who may not know, there's a little National Collegiate Championship football game on tonight. But in any event, and I want to thank the staff again for all the information that you presented this evening. So with that being said, we are adjourned.